What if I told you that your regular headache isn't just stress or fatigue, but something building pressure inside your skull right now? Let me ask you something. Have you ever had a heavy headache, facial pressure, or a plugged nose that just wouldn't go away? Most people assume it's just a cold, but sometimes it's something deeper. Today, we're talking about sinus infections. What are they? Why they happen? When they become dangerous? And how you can treat and prevent them. Stay with me because one mistake most people make can actually make this worse. Let's talk about what are sinuses. Your sinuses are air-filled spaces located inside your skull, around your nose and eyes. They include the frontal sinuses in the forehead, and number two is the maxillary sinuses at cheeks, the isthmoid sinuses between the two eyes, and the last one is the sphenoid sinuses, this deeper behind the nose. Their job is to lighten the skull, humidify the air you breathe, help filter particles, and enhance your voice. So, if they are normal, why do they cause so much pain? A sinus infection called sinusitis happens when these spaces become blocked, inflamed, and filled with mucus. This creates pressure, and that's where the pain begins. Let's talk about the common causes of sinusitis. The common triggers include the viral infections like the common cold and the bacterial infections, allergies, nasal polyps, deviated septum, air pollution, or smoking. According to, and sinusitis is one of the most common respiratory conditions worldwide. Let me tell you what are the symptoms, and here is where it gets tricky. Typical symptoms include facial pressure or pain, nasal congestion, thick nasal discharge, maybe yellow or green, headache, especially in the forehead, reduced sense of smell, and finally, fatigue. But here is the surprising part. Not every sinus headache is actually sinus related. Many people confuse sinus infections with migraines, tension headaches, dental problems, or allergies. Studies indexed and show that misdiagnosis is very common for this case. Now let me tell you some home treatment for mild cases. If symptoms are mild, you can try staying hydrated, steam inhalation, saline nasal sprays, rest in warm fluids. Avoid overusing nasal decongestant sprays. They can worsen symptoms over time. Yes, something you use for relief might actually make it worse. When should you see a doctor? I will tell you right now. Seek medical help if you feel symptoms that last more than 10 days. High fever develops, severe headache, swelling around the eyes or the nose, vision problem. If left undertreated, sinus infections can rarely spread to nearby areas, leading to eye infections, bone infections, or even brain-related complications. It's not common, but when it happens, it's very serious. Now let's talk about the prevention tips. You can reduce the risk by washing your hands regularly, managing allergies very fast, avoiding smoke and pollution, stay hydrated using a humidifier for the air around you. And finally, sinus infections are common, but ignoring them can lead to bigger problems. Listen to your body. treat early, and don't ignore resistant symptoms. If you found this helpful, share it with someone who always complain about sinus headaches. And let me know in the comments what symptoms bothers you the most. Follow for more simple science-based health content, and your health is not something to guess. Understand it and treat it very well.